Well, good afternoon. It's such a pleasure for me to be here. I'm Mayor Christina Shea, and I'm here for another one of our virtual tour town halls. With me today is Councilmember Farrakhan to my right. Also joining us today in person and via WebEx are experts from our medical community to help answer your questions. I'd like to take a moment to introduce our special guest. First, from Kaiser Permanente, Dr. Todd Newton. Area Medical Director John Stratman, Senior Director. From UCI Health, Dr. Bernadette Bowden-Albala, who's been with us many times and doing my press conferences with me. Director and Founding Dean, Program in Public Health, Professor, Department of Population, Health and Disease Prevention, and Department Epidemiology. And I couldn't say that word a month and a half ago, but I'm becoming an expert. And from the medical care, Dr. James Leo, Chief Medical Officer. And so thank you so much for all of you being here on our WebEx. I hope that we can maneuver this well, because with you're not here, it's going to be difficult a bit to be able to reach out and make sure we coordinate the questions, but we'll do our very best. So at this time, unfortunately, let me just share this. A few of our medical experts from Hoag and OC Healthcare Agency that we did invite at the last minute had conflicts and were not able to participate. So at this moment, I would like to turn the podium over to Councilmember Khan to say a few words.
Thank you, Mayor Shea. I'm so happy to be here today for this important discussion. Again, a special thank you to our panelists for taking the time from their incredibly busy schedules to be with us today. As we move forward in this global health crisis, it is critical for these conversations to take place with our medical experts. Thank you to our community members for taking the time to be a part of this town hall and for submitting your questions. We hope to get to all of them, but if not, we will provide updates on our website at cityofirvine.org/COVID-19. Mayor Shea, shall we get started?
Yes, let's do. So at this time, we will be hosting the questions from the audience, and I will start with the first question. And this question is from D.E. We don't have the last name, but D asks, will you be tracking the virus once we open so that we know if it's going up in numbers, both for those that have it and that those may have died from it? So why don't I turn it over to our esteemed doctor next to me on the left, and if you would answer that, and then we can go to our panel as well.
Sure, thank you. So first of all, COVID-19 is a reportable illness, and so it is being tracked. The Orange County Healthcare Agency collects that information, has that, and it's published every single day. So even when we open up, and forever until there's a decision not to track it, COVID-19 will be tracked, and we will know what's going on here in the county and in Irvine.
Great, wonderful. Do our other experts like to answer that or have anything to add?
Hey, this is Dr. Newton. Nothing from my end other than, yes, we get the updated numbers daily from Orange County Health Authority, and it's very useful.
Thank you, Dr. Newton. I also want to just, before I go to the next question, we just got the numbers today that our cases in Irvine are now at 229, and just 3 days ago, they were like around 135. So that's a very large increase, considering since this began, we only were at 135. Perhaps you could ask the question, what do you think's attributing to this increase in just the last few days?
I think there's a few things that are contributing to the increase that we're seeing throughout the county and in various towns. One, there has been some relaxation of policies, or at least individuals are taking some liberties in relaxing policies. I think we had the holidays a couple of weeks ago, and people were visiting other folks, and we're really supposed to shelter down in place, and I think that there was some loosening of that. People have been visiting the beaches, and I think people are feeling a little bit better. Spring is here, and we want to go out. And it's really interesting how sensitive these numbers are with regard to the kinds of behaviors that we practice. And I think what we're seeing, again, is that. I also think we're seeing some more cases in nursing homes. And as we know, a case in a nursing home, another case in a nursing home, a third case. The transmission is really fast in these nursing homes. So I think some of those numbers may be attributable to that as well.
Dr. Newton or Dr. Strapman or Dr. Leo,
Yeah.
do you have any response?
Sure, I can weigh in here. It's Dr. Newton. Absolutely, the number of cases are going up in Orange County. We are testing more across the board. You can see that on the county website. However, what we use, which I think is really a better proxy, given that the number of tests will be variable, and also, the time frame of getting the test back will be variable, is we use hospitalizations. Also on the county website, you can see the number of folks who are being hospitalized for COVID, and that too is going up. It's going up slowly, but it is going up. And recently we hit our apex for the highest number of ICU patients in the county as well. So there's no doubt in my mind that one, increased testing does play a role, but two, the relaxation of some of the social distancing is probably playing a role as well. And we are seeing the numbers go up.
Just for clarification, as I looked at these numbers, the numbers for Irvine have not gone up 100. This is 229 have gone up for the county. So for Irvine, for clarification, it's just gone up 3 today. Is that correct? So we are still tracking at a very good level. That goes to show why I should not be working at the Orange County Health Department. You should be very happy about that. Dr. Leo or Dr. Strapman, any other comments you'd like to make?
No, I think my colleague, Dr. Newton, summed it up very nicely.
Okay, great. So now we'll turn to Councilmember Khan for her next question.
Thank you, Mayor. From Enrique J. Will there be any testing offered by the city? And what do you think about tracking infection cases and making this information public? For the first part, at our last City Council meeting, we did approve testing for the city of Irvine, which will begin May 26th. And that is for the virus, the PCR testing that'll happen here for all our residents. And then for the second question, I'll send it over to our experts here.
I would say that I think the second question was, what do you think about tracking infection cases and making this information public? And again, the Orange County Healthcare Agency is doing that and continues to do that, and I believe is done not just across the county, but by cities and towns. So I think that that will continue. I would just like to say that in terms of testing, as you've already heard from Councilmember Khan on that, I would also like to say that that UCI Public Health, in a partnership with Orange County Healthcare Agency, will be undertaking a county-wide surveillance study looking at antibody titers in among residents in 5,000 people across Orange County. And that will begin in the next week or two.
No. Okay. Any other responses? Just mention who you are and just go ahead and respond. Okay, so our next question is from Wendy T. Will there be any facility for testing for virus? At this point, will it be necessary to get testing even if I haven't had any symptoms? I can share with you just directly what the city has done, and I know Councilmember Khan referenced it as well. On the 26th, we will have drive-through testing, the antigen testing, which is the swab, either in your nose or in your mouth, and then the antibody test. We did approve it, but I think we're going to have a further discussion about that because it is not FDA approved and doesn't even have the EUA approval, which is just the temporary approval. And because of that new information, I think we'll probably end up, but we'll talk to council on the 26th, that we might just stick with the antigen test as our drive-through, and it will be free. If you don't have insurance, if you have insurance, you'll go online and just put your insurance in. So if you want to answer any questions about the facility testing for the virus around the county, I know you might want to share about UCI.
Yes, so UCI has a number of drive-through testing facilities. Again, there are folks you can just call and talk to if you have symptoms, if you know somebody who has COVID and or you feel you've been exposed, and if you are an essential worker, you would be high priority for getting testing. And UCI is not the only medical institution in the county that has this, and I don't know if any of my colleagues online want to talk about their testing facilities.
This is a big topic for everybody.
Yes.
Yeah, we've been at Kaiser Permanente in Orange County. We've had drive-through testing at our Anaheim hospital site for quite a while now, going back to mid to late March. We're currently testing about 175 patients a day there, and those numbers are slowly increasing. We'd like to be able to test more, and we're thinking about in the next several weeks opening a drive-through site at Irvine, but we're still finalizing plans for that.
And I guess I just want to add to my colleagues that I think it's very important to understand that if you're getting tested for active virus, this PCR testing, that means that if you test positive, that you do have active virus and that you should be under the treatment of a physician. But it doesn't mean that you would not if you tested negative, it doesn't mean that a week from then you wouldn't test positive had you been exposed. And so it is a one-point-in-time test. And I think that's really important for people to remember.
Yes, it is.
Absolutely.
Any other thoughts or comments from our panel?
You know, the one thing that I would share, Mayor, is obviously I don't represent the County of Orange, but I am on numerous calls with the County of Orange. And I know that they are setting up numerous sites throughout the county. 11, I believe, is the last number I heard. I'm not really sure where those exact locations will be, but I would encourage your residents also to check the website for the County of Orange to see if they are listed there.
That's a good point, because they have received $550 million of federal care money that's come in, and so they've been opening up all these test sites. And I know that I was told last week in a WebEx that with all of our mayors around the county that they have actually set up a contract with Hoag, that around the county, Hoag would be hosting the antibody testing for the community. So I think we're going to get more information about that as well. Okay, so if there's no other more comments, I'll turn to Councilmember Khan.
Thank you. From Lynn R., will I ever feel safe going to a doctor's appointment? And I'm going to ask an additional question to that I've been receiving from the public is also dentist appointments as well. So if we can get our experts to answer these two questions.
I can start. Yes, you will feel safe. I think it's really important. Vigilance is the most important thing that we can do. Vigilance means continued hand washing, continued use of hand sanitizer, wearing masks, keeping your distance. One thing that I think is probably happening a lot with physicians that I've heard in the area is that there's the use of telemedicine, which has been really tremendous, so you can see your physician and not have to leave your home. But for those that do have to leave their home and do have to see their physician, and that you can feel rest assured that if you're being vigilant, that clearly the physician and everyone in that office is being vigilant. It's very important if you think about COVID-19, and we see that people that are the highest risk for poor prognosis are people that have a lot of other comorbidities. And now is the time that you want to make sure that you are well so you can have the resilience to be able to fight this. So if you have hypertension, you want to keep that under control. If you have diabetes, the same thing. And oftentimes that means going to see your doctor and getting your blood pressure checked, getting your hemoglobin A1C checked, keeping your weight down. All of these things are really important. If you have asthma, the same. So you should see your physician if you have medical conditions that warrant seeing the physician, and this is the time to be doing that. I know that across the county, elective OR procedures that had been canceled are now being scheduled again, because we need to be in the very best of health in order to be the best in combating COVID-19.
Very good point. Any other comments or statements from our panel? I see one of our panelists, but I can't hear him.
Can you hear me now?
Yes.
Yes.
Good.
Great. So at MemorialCare, this is Jim Leo, we are ensuring that, first of all of our office staff and the doctor's offices are using all appropriate personal protective equipment. And consistent with the CDC's guidance around what they call universal source control, we are asking that all patients who come in are also wearing a face covering or mask. So doing it on both sides of the equation helps to significantly reduce the likelihood of disease transmission. It's an important practice to follow.
Let me ask a follow-up question to something that was brought up about going to see your doctor. I've heard that I have Kaiser. I have my insurance through Kaiser. And I was told that some of the Kaiser doctors just have you call in as a telecommunication, telehealth call, that they really don't want patients coming into their office, everybody that could be sick and infecting them and their nurses and whatnot. Are we seeing a lot more of the telehealth communication rather than really setting up appointments and going into the offices? I think people ask about that as well.
Yeah, Mayor, it's Dr. Newton. I can answer that. We certainly have gone to virtual medicine during this for quite a few reasons, but it's not entirely true that you can't get in for a face-to-face visit. What we are asking is that folks have a telephone visit or a video visit first, and then we're directing people who need to be directed to some of the MOBs, which we have designated as respiratory MOBs. So we are taking patients there who may have COVID, and we're seeing them in an urgent care setting. Alternatively, you might be directed to one of the 2 ERs as well. But we are doing much of what we normally do by phone and by video over the coming weeks as the rest of society opens up and the governor's direction changes. We'll slowly get back to our old way of doing business as well. I will say that we've had great success with video and telephone appointments so far that our patients, by and large, not across the board, but by and large, love it. And I do think it's here to stay in one way, shape, or form. We were doing it before, and we'll likely do it more often in the future.
I think it's a great idea, and I think it's like you're just doing all the pre-screening, so it saves the backup at the offices. It really does keep everybody safe in the offices. So I think it's a great approach, and I would assume it probably will continue, and I think it's a great practice. Any other comments? So I'll turn this to Councilmember. Oh, I'm sorry. Did someone else want to say something? Okay, Councilmember Khan.
I think it's your turn.
Oh, it is? Oh, it is my turn. Okay. This is from Alan V. Why is wearing masks not mandatory, along with testing and tracking all Irvine residents? Well, first of all, masks are mandatory. We approved this about a month ago for anyone that goes into a retail commercial site. If you're a customer, you have to wear a mask. Because we were noticing that if you were in a grocery store and you were 6 feet separated, that was fine. You get up to the grocery store checkout and that would be fine. But by the time you got to the clerk, you were within a foot of the box person and also the clerk. And so it really, the whole process bringing you up to that point just fell apart when you got to checkout and they're taking your bag. So we really did suggest that it had to be mandatory, and it is mandatory now. It's also mandatory for all retail and businesses that are doing business with customers face-to-face. Anywhere where you can't have a 6-foot distancing, you are required, and it is mandatory that you have to wear a mask. Now, with testing and tracking, because it's been so difficult to get the testing, we are now moving in, as we said, into this drive-through testing, and we will be asking and probably requiring, I would assume shortly, that all businesses that are going to reopen, they're going to be needing testing their employees, because I think it just creates a security and a safety feature for the employees between each other and also when you're visiting the business. So that will be something we will be doing. Tracking is something actually, and most of the testing and tracking is really overseen by the Orange County Health Department. So we're very careful not to get too far into their directive. So maybe I can turn to our panel and see if you have any additional answers that you would like to bring forward.
I don't know if my colleagues want to say something here.
It's really probably more directed to the city, but anything about tracking that we may want to talk about, maybe explain what tracking is?
Sure. So there are really a couple of key components, and I know that you've all been listening and hearing a lot of these words like contact tracing and testing, and these are key components to keeping any kind of keeping viral transmission down. And the first is testing, so that you know who has the virus, and then once you know who has the virus, finding out who they've been in contact with basically for the past 2 weeks, and then contact tracing is tracing those people and then following up with them, having them be isolated as well, and also having them get tested so that you can basically halt the transmission. And so the Orange County Healthcare Agency hires folks that are contact tracers. And as soon as a disease like COVID-19 is reported, that there is this contact tracing. They go out and they find out who the individual who is COVID-19 has been in contact with, and then works with all of those that they have been in contact with to get testing and to be isolated. So again, if you have COVID-19 or you know someone that has COVID-19 and you've been in contact with them, isolation is the key, and of course medical treatment for symptoms.
Good point. Any other questions, or I'm sorry, any other comments in regard to that? Okay, with that, I will turn it to Councilmember Khan.
We have a question from Ahmed N. Where can we do the tests? I have a senior in my house. Where can they do the test? So as we mentioned earlier, for Irvine residents, we will have drive-through testing available May 26th, and basically, more information will be coming out soon on how to register and get a time slot. However, essential workers and the folks that are falling in the vulnerable population can be tested by the county right now. You can visit ochealthinfo.com to get more information. And if our panelists can share some of their information as well, that would be great. Perfect.
Okay, so hopefully that answers that question. And the next one is from Mady J. When will there be antibody testing in Irvine, and when will there be lots of diagnostic testing in Irvine? We have talked about our drive-through plan that we're working for all of our residents, but I would like to turn this over to the panel, and they could share more about more of the testing that's going on. We've talked about, sometimes we get redundant questions, but maybe to expand on that, let's do that.
Sure. So first, there's 2 kinds of tests that are being done right now. One is the antigen test, the PCR, and that's looking for active virus. The second test is the antibody test, and that really lets you know if you've been exposed to the virus and if you have developed antibodies to that virus. And currently, at least at UCI, and I'm sure my colleagues will speak about their medical institutions, anyone, we talked about, again, the antigen, we talked about how to call if you have symptoms or if you're in a vulnerable population or an essential worker, that you can get that initial testing to see if you have active virus. Likewise, there are platforms that the Food and Drug Administration have approved for testing antibodies. Again, your exposure to the virus in the past, so that would be weeks plus in terms of exposure, and you no longer have the virus but you have developed these antibodies to the virus. And at UCI, anybody with a doctor's prescription can be tested to see if they have antibodies to that, and I know that my colleagues likewise have similar setups.
Is there any other response from our panel?
So at MemorialCare, we are focusing on the antigen or PCR testing, not the antibody testing, because at the present time, the antibody tests are all approved by the FDA only under the Emergency Use Act, and are really valid for looking at whole populations, but are not helpful in making individual patient decisions about whether a person is protected from disease. We don't yet know if antibodies actually provide immunity for people, and so the recommendation from the public health agencies and other groups is use them for population testing. We believe that the focus on the PCR testing is best for doing the actual diagnosis.
And I don't think actually that we've had a day where we've actually exceeded the number of tests in terms of the PCR across county that we have available. So I think that more people can get tested if they meet the criteria for PCR testing.
Okay, which is very good for us here in Orange County.
Yep.
I'll turn this over to Councilmember Khan.
Right. So from Wendy O, what are the plans to make more testing available? What are your plans for social distancing and wearing of masks in public? So I believe we've gone over more testing. Maybe our healthcare professionals here can share a little bit about what their organizations are doing as far as ramping up more testing. And our plans for social distancing and wearing a face mask, I think that's been pretty consistent since the beginning, is we're encouraging everyone to keep that 6 feet of physical distance between you and another person. And at the same time, when you're going out, we are strongly recommending that you wear a face mask, but it is mandatory when you are in a commercial or retail environment. And I'll hand it over to our panelists to add anything else to that.
Yeah, I would just say that as we begin to reopen businesses, there's going to be a lot of questions by the small business owners and even larger businesses, corporations. And, you know, at UCI and Public Health and at UCI Health, we're really there to help in any way with your questions. And this doesn't have to be the venue for that or the platform, but you should feel free to contact us about that, because different businesses are going to have different questions and requirements, you know, in terms of, we've done a very good job, I think, overall with grocery stores and social distancing, but, you know, clothing stores, you know, bookstores, there's going to be different requirements, and the CDC has guidelines, Orange County Healthcare Agency has guidelines, and we practitioners and folks in public health are really there to help you to try to take those guidelines and really, you know, make them work in your new business or your business.
I would say the one positive, there's been many positives coming out of this crisis, but for me, being able to be more involved with our healthcare workers and county representatives coming together regularly, all the other cities, communicating how we can care for our residents has been a very interesting process and a very positive process. So we're very pleased about these relationships that we're establishing, having much more communication. So from Arlene O, and we have answered this question, but I'll just be very brief. Status of the proposed plan to offer drive-in testing for city employees and residents. Once again, for the city of Irvine, probably one of the first cities to offer testing for our general public. We will be posting an online site with U.S. Health Fair. You'll go on and it's very simple. You put in your insurance background if you have insurance. If you don't have insurance, we will do this for free. We'll be setting this up at the Great Park 4 days a week. You'll come in on Marine Way. It'll be right there at the parking lot of Marine Way and Skyhawk Circle. You'll just drive through. We're going to start with 2 lanes, and we'll be able to test around 360 residents a day. And we may find that if we get a lot more signups, and it'll be by registration only, so you don't have to wait hours in line. They will give you a time to come. It'll be a 10-minute period of waiting, if even there is a wait. So we're going to make sure it's very efficient. And then if we find that we really have a lot more need for the testing and many, many more people are signing up, we'll go to 4 lanes. But again, we think it'll be very efficient. That'll be the swab test. You'll come in, come out, but that will, as the doctors have indicated, it will be a point in time, but at least you'll know at that point, do you have it? And the benefit for this test, and people question it, is that at least it allows us, if you're active, then we can tell you to isolate and then do this tracking and making sure your family and friends that you've been involved in will also have to be isolated for the 14 days. So it really gives us a great ability to make sure we identify those that are active but are maybe asymptomatic. So this is the point we're doing it. Plus, we want to provide this service to our residents. Many have asked us to provide this testing, and so we're very pleased to do it. And so that answers that question. And Councilmember Khan.
Thank you. So from Kelsey G, Irvine is supposed to be the safest city in the country. How do you justify opening the city up in the middle of a pandemic against the advice of epidemiologists and risking the lives of all your citizens? So just want to be a little clear, we haven't opened up the entire city. It's very specific items that we have opened up. It's the golf courses are open, but there are specific guidelines on how they are to be operated. They can't operate the way they used to. The same goes for the tennis courts and the pickleball courts that we recently opened. Outside of that, really we haven't taken any other actions, and we'll be continuing to monitor the numbers, the data that's coming in, and conferring with our medical experts as we move forward. And Mayor, would you like to add anything to that as well?
I think you pretty much covered it. We have been very conservative in our approach to opening, and we're following the guidelines of the state of California and the county. We're spending a lot of time with our council members talking about every request we get, but we're really looking to implement the opening in a very cautious and careful way so that we are not just rushing into this, even though we have a lot of pressure from folks to ask us to open our parks more, our tot lots, which I think may be the next step. We will have to see. But the swimming pools and some of the other activities, sports fields and opening up games, soccer games, this is where a lot of people congregate, and this is where the real problem would begin, and we're going to be very cautious and take our time before we would do something like that.
Yeah, and before we move on, I know previously the doctor and I were talking about pools, because a lot of people are asking about opening up public pools. If you could just maybe briefly describe the dangers of opening up public pools at this time.
Yeah, I think that, this is obviously a disease where we're trying to keep air droplets down to a minimum, exposure to viral particles through air droplets and also through touch. And so even though people have made the case, well, pools are chlorinated and chlorine kills viruses, and that's absolutely true. It's the folks that would be next to you in the pool, or you yourself inadvertently spitting or just speaking and having air droplets, just kind of spreading out, and also getting in and out of pools. Again, it's that stairway, it's the touching and the constant repeated touching of many, many people. And that really, and then again, not having good social distancing. All of those things are real reasons why, opening up pools would be problematic.
Okay, so question 11 from Narges A. I can undertake that a lot of folks are keen on reopening. However, I strongly feel that we will inevitably see an uptick in COVID cases after reopening. How prepared are the hospitals to manage this? Are they stocked on PPE, ventilators, and meds? So I think I know that answer, but I'm going to turn it over to our panelists because you could answer it much better.
Well, so I think I'm going to turn it actually to our colleagues from Kaiser. If you guys want to say something first.
Yeah, sure, be glad to. It's Dr. Newton. We're prepared. Like the rest of the world, PPE is not in abundant supply, but we have what we need right now, and we are stockpiling more in case there is a second surge or even a third surge potentially. We aggressively were able to obtain more ventilators at the very beginning of this, really even before ventilators were something people were thinking about, because we are in the hospital business. That's what we do. So we were a little bit ahead of the curve, and we as we sit right now, are in good shape there. I think really the devil's going to be in the details. Let's all admit that we are in uncharted territory, and we really don't know what a second surge, if it does occur, what it'll look like. So, we can't be passive, and we certainly can't let our guard down. But right now, we're very prepared. In fact, I think, and I don't want to speak for my other colleagues, but I'll just say from my perspective that the entire county has done well. The hospitals are largely, they have capacity, and people are in pretty good shape. But again, we're not seeing New York type numbers right now. So I think it just depends on what we see in the future.
Dr. Newton, let me follow up with a question. When it comes to elective surgeries, are you, because we are not overwhelmed in our hospitals, similar to what happened in New York and New Jersey, are we moving back into doing more elective surgeries? Because I know the medical profession was really getting into some very difficult times. 20–30% of their employees were actually furloughed or not working because there weren't any cases. We were having to set beds aside for in case we really had an overwhelming amount of COVID cases. So it really did affect the medical community. So I would like to know what your thinking is in regard to that and what you've experienced.
Yeah, we're going to slowly and cautiously but steadily increase our elective surgery volume. We have those plans in place. In fact, we are preparing to start doing that really any day now. I think we're about 5 days away from when we'll start introducing those patients. Again, it's very complex because you have to keep social distancing, up and running. You have to not overload your waiting rooms. You have to make sure you're bringing in the right cases. But we are going to start doing more elective surgery, and not just surgery. We're going to start doing more elective procedures as well. I mean, it is definitely a dance here, and I'm sure my colleagues from UCI and MemorialCare will agree. You can't stop delivering medical care to a gigantic population of people without unintended consequences as well. And so we are committed to, as soon as it's safe and possible, to getting people back in to get the care that they need.
Dr. Leo from MemorialCare, I would just agree and say we actually started resuming some surgical procedures and other procedures on May 4th in a very careful manner, starting with those patients whose procedures had been delayed and were therefore increased in priority. So we're asking our surgeons to be very careful about who they ask to come in initially to have those procedures done. Make sure it's the high priority patients.
Thank you. And Doctor?
Yeah, so I totally agree with my colleagues. We cannot stop providing care for patients that need care at UCI for elective procedures and for non-elective procedures. We're testing patients to make sure that they do not have COVID before their surgeries. The other thing I think that everybody should know is that all of the medical institutions across the county work together and are working with Orange County Healthcare Agency. Everybody has, I think, in anticipation of an initial surge, increased their capacity to be able to provide the very best of care to all patients that needed it, including ventilator care, ICU care. We work at UCI in public health on a daily basis with Orange County Healthcare Agency. We have our epidemiology disease modelers working with their epidemiology modelers. And so every single day, we are looking to see if these numbers are, if the curve is not flattening enough, if the numbers are going up, if there's going to be a surge. And I know that, and what that would look like. And I think it's going to be a lot more up and down than what we saw in New York was this huge peak and surge. And that's because we have been so good across the county at monitoring all of that. So you should be really assured by that, but please assure us that you're also keeping your social distancing and all of your vigilant antiviral behaviors in place.
Very good point. Councilmember Khan.
Great. Next question is from Mary C. How soon will we have antibody testing available on a mass scale in Irvine? As we've discussed earlier, with the recent information that we have, it doesn't look like we're ready to provide antibody testing in mass. And I'll send this over to our medical experts to share what their thoughts are.
I mean, I think that we're working with the county on 3 kinds of surveillance studies. One is a very quick looking at discarded bloods with the partnership and cooperation of most of the medical clinics throughout the county, and Dr. Matt Zahn at Orange County Healthcare Agency and Dr. Nicole Quick are part of that study. That's surveillance 1. The second surveillance, again for antibodies, is a county-wide 5,000-person surveillance program that will start in the next couple of weeks. And the third, again with all 3 with Orange County Healthcare Agency, is to do a randomized sampling of healthcare workers, first responders, and others that are involved in healthcare across the county. All 3 of those will give us a sense of what the prevalence of antibodies is across the county, and I believe it was Dr. Leo that talked about county level or population level estimates. We think that the numbers will be very similar to our neighbors above and below us at about 5%, which means that 95% of the population remains vulnerable. But we will see what those numbers suggest, and I think based upon those numbers, I think the county and all of the medical institutions will make some more decisions about mass surveillance, mass prevalence antibody testing.
Wonderful.
Mayor, can I weigh in on this one too? It's Todd Newton. I appreciate the answer from my colleagues, and I agree 100%. I think, there's a lot of questions out there about antibody testing, and I understand why. And I do believe antibody testing is going to be key for us. However, there are three things we have to remember with antibody tests. First, the test has to be accurate. The first tests that were released, many of them were grossly inaccurate. Some of them are actually worse than a coin flip when you start crunching the statistical numbers. So they were terrible. Secondly, we don't know if the test is positive, what that does. We don't know if that confers immunity to someone. And I brought this up in our last city council meeting. Some disease processes like measles, you develop antibodies and they're quite effective. Other disease processes like HIV, you develop antibodies and they're worthless. And so I think, we really have to know, one, what it means to have antibodies. And then thirdly, when you have a low prevalence, as my colleague just mentioned, of potentially 5%, it could be less, could be a little more, you really need a test that will not give you false positive rates. So you have to have a very, very good test. Now, there are a couple that are coming out that look very good, if you believe the numbers that they're quoting. But we haven't, up until now, had those. And so really until those three things are met, and I guess you could add a fourth in terms of scalability. So even if all those are met, then you have to be able to scale the test to test thousands and thousands, if not hundreds of thousands of people. I can tell you that I just don't think we're there yet.
Thank you. That was something you brought up in our WebEx we had last week, and it was very informative. I know the governor has said we're all learning. The medical professionals learning, all the political folks are learning. We're all learning. He said it's like getting in an airplane. It's already taken off, and you're trying to figure out how to finish building it. So it's just been a real learning curve for all of us. So I appreciate that, and hopefully we can find more solid information for everyone, but we're just learning as we go. So there's a lot of experts that have a lot more knowledge than some, but also I don't think anyone has the complete answer for many of these questions. So thank you. The next question is for me, and it says, how many deaths from COVID-19 have occurred from the residents in the city of Irvine? To my understanding, we have had no deaths, but I would like to turn this over to our experts, Kaiser or MemorialCare or a doctor from UCI. Have you had any information? But as I understand from the Orange County Health Department, we have not had a death in Irvine. Is that accurate?
That's my understanding as well.
Okay. Dr. Newton or Dr. Leo, any other, or Dr. Stratman?
Yeah, we certainly haven't, and that's my understanding.
Yep. Likewise.
Well, that's great. It makes me feel good that our city has sort of been able to weather the storm and not have experienced that at this time, and I hope we don't. So thank you so much. And that was from Susan S. Councilmember Khan.
Thank you. From Grace N. How is the city of Irvine preparing for the second wave of COVID-19? Is there a plan in place? And also, the question came up that some grocery stores are taking everyone's temperature before entering. Is that effective?
I can talk about the temperature if you'd like.
Sure.
So it's taking temperatures before entering stores, before going to work. Has been an approach that some have taken. What does it mean? It means that if you have a temperature, that you have a fever, and that's all that it means. Now, of course, fever is an important symptom for COVID-19, but it's also important for a lot of other illnesses, both chronic and infectious. And so I think that the literature is not out there that alone is good enough to to say that person has COVID and that they cannot be allowed to enter. I know that at UCI Medical, and I'm sure at our colleague medical institutions around Orange County, that there is this daily temperature taking in the morning and symptom checkoff, so that nurses and physicians and technologists heading into the hospitals are not going in if they have a fever. And I think that since fever is a symptom of COVID, that people should be staying home and watching the rest of those symptoms and seeking medical attention if they persist or if people feel they've been exposed to COVID and need testing. But I don't think right now that we're advocating temperature taking to go into a store.
Any other thoughts?
I can answer that on behalf of Kaiser Permanente. I agree with that. For us in our locations, we are very aggressively screening every visitor. We have a very limited visitor policy or very strict visitor policy right now at all of our locations, specifically both of our medical centers here in Orange County. But we do have screeners, so we are doing temperature reads on not only employees and physicians. I know Dr. Newton himself, we get screened every single time we enter or enter the facility. But there's also the series of questions that the CDC has asked all medical providers to question and to look out for on any visitor or any patient that we see. So I think it goes further than just taking a temperature. You really have to do a little deeper dive as to where that individual has been, who they may have been around, and also some of the symptoms that they may have felt last week, and not necessarily the morning that they woke up. So I think it's a much larger question and a lot more actions that need to be taken.
I'd like to follow up on a question, if I could. When someone is asymptomatic, would they have a temperature? Would they be normal? Or would they have just absolutely no symptoms? If you could explain that to me.
Sure, I'll take that one on. The answer is that they can have no fever, they can have no symptoms, no signs, no hint whatsoever that they're ill. And so the whole concept of screening for temperature and symptoms is what we would call a both and. It's a great thing to do along with helping people understand that they can actively have and shed the virus to others without having any hint whatsoever that they're ill. And that's where social distancing and masking come in handy or are absolutely necessary, in addition to doing the temperature and symptom checks.
Any other thoughts on that? Because I think that's confusing to people.
I think it's confusing, and I think one of the issues, and I believe my colleagues all brought this up, and just to reiterate, there's a lot we don't know about this virus, and so we don't want to go out there and say if you're feeling fine, that it means that you absolutely do not have the virus, because there are asymptomatic folks that have the virus, that inadvertently spread the virus. And we don't really have a good sense of children as well. We're hearing more coming out of New York and other places, but we really don't know. And so, again, what we can just do our very, very best. And again, I think that's about screening, about testing, and about contact tracing, which I think is part of that equation. And the community can do their very best. Again, if they're not feeling well, they should just not go out.
Good point. So we're coming near the end of our program. We have a couple more questions, and generally the few that we have in front of us are similar to what we've already answered, but we appreciate the audience reaching out and asking us these questions. But this is from Valerie J. Can you overview the types of testing available throughout the county and what those tests mean? Antigen, antibody. I believe we've explained it, but maybe just before we end, just to get very clear understanding in simple terms, what is the antigen test and what is the antibody test, and how are they implemented for? And I know there's different tests for, the finger test for the blood. There's the taking the blood out of your arm, which I had last week. So if you could explain that in a little bit more detail, that would be great.
Dr. Newton, do you want to start?
Sorry, I had to unmute myself. Sure. I mean, in the simplest form, I think the antigen or PCR test is the test we use to determine whether or not people currently, right now, have an active infection. And that's the test that we have used at Kaiser Permanente right now to determine you have it or you don't have it. And as mentioned earlier, it's good, but it's only good today. It doesn't necessarily tell you that, whether or not you're going to have it tomorrow. The antibody test is one that tells you, whether or not you were infected at some point. And usually the antibodies form anywhere from a week or two after the symptoms start. And so they're used for different things. Ultimately, I believe what we'd like to do is use the antibody test to see if people may have immunity. Although for all the reasons we discussed earlier, we don't know if that's the case. But that's the main difference, is one is used to say yes or no, you've got COVID, and one is used to say, well, you were infected at some time in the past.
Okay, thank you. Doctor, can you explain what PCR actually means in a very simple way? And I know you said it's very complicated, but we keep using that phrase, and I'm thinking...
Dr. Newton's laughing, right? So polymerase.
I keep using that phrase. I can't imagine we understand.
I'm not a lab scientist. Polymerase chain reaction is just the type of test to really understand active viral shedding and to look at the antigen, which is very different than the antibody. Again, I think it's complicated, but I do think that, again, that when we talk about PCR tests, we're talking about, again, to get PCR, we're talking about getting nasal swabs. Some folks are using oral, and very different than looking at antibodies, which, as Dr. Newton said, are made in response to having been in contact with this, and that is typically a blood test. It is the blood tests that where we're actually doing phlebotomy, we're actually taking blood as opposed to, or taking a vial of blood as opposed to just a finger prick, are more likely to have been approved by the Food and Drug Administration. That is changing, but I do think that there are over, I think, Dr. Newton, correct me if I'm wrong, but I think that there's at least 200 types of antibody tests out there right now, of which I believe, at least as of a day or two ago, 13 were actually approved by the Food and Drug Administration.
Just recently?
Just recently? Yes, and so I think that...
what does the acronym PCR mean? That's what I want to know.
Polymerase chain reaction, PCR, and it is the type of testing that we do to actually identify active virus.
Okay. I still don't get it, but thank you very much for... I understand the principle, and hopefully the public does as well. So I'll turn to Councilmember Khan, and maybe, I don't know if you want to pull both of the questions. We just have like another minute or two.
Okay, and then I also want to say, I know a lot of people are asking questions as this town hall is going on. The questions that we're answering right now were the ones that we received prior to the town hall starting, but we do assure you that any questions that we're getting during the town hall will be answered by our panelists or ourselves, so we'll get those answers out to everyone. But the next question comes from Tina P. Is review of the more detailed data available for Irvine, including number of people tested and percentage positive, hospitalization, and deaths. As of right now, the Orange County Healthcare Agency hasn't provided us with these detailed data points. We were told that we should be getting those data points soon, but once we get our own testing started, I think we'll see those numbers even more clearly, because we'll be able to get that data immediately as well and share that with the public. I don't know if our panelists want to add to that at all. No?
Just that as we said already, the Orange County Healthcare Agency has done a really good job of providing us with all of this data. And Orange County, we're all living in Orange County, so we have to be careful not to, the virus doesn't delineate Irvine from Laguna. So even though you guys are doing a fantastic job, I think thinking about this at the county level is important.
Exactly. And the last question, again, it's very similar to the questions that we've had in the past, but mostly focused on from this question from Christine K. She's talking about forecasting capabilities to test and conduct contact tracing in the coming weeks. Are we going to be more sophisticated moving forward? Are we going to have more opportunities to know how to do this that is easier to do or to implement? So if you could just answer that, then I think we'll be near at the end of our panel.
Great. So I know from speaking with our county health officer, Dr. Nicole Quick, that they have hired more contact tracers over the last few months in anticipation of what would be going on and the need. And I think that over the entire state, at the state level, there's really been a call for training more folks to do contact tracing. And there's going to be a lot of different training programs. At UCI, we will be doing a 40-hour training in early July for a lot of students and others that want to be trained, and with the hope that with that training, they would be hired by Orange County and other counties around here to help support these efforts, because it does take a lot to do contact tracing.
Right, I can understand. You'd have to have a lot of good training to understand what you were looking for. So I just want to turn to Dr. Newton, Dr. Stratman, Dr. Leo. Are there any other follow-up or final questions or comments you'd like to make?
No, thank you for the opportunity to join you today.
I know you're so busy.
Thank you for the opportunity.
I understand that all of you are so busy. You have such a heavy schedule, especially during this very difficult time, and I can't tell you how much we appreciate your participation today. And I know that if there's any other questions, we can certainly get back to you as the days and months progress. But thank you very, very much for all your support in our panel. Thank you. And to Councilmember Khan, thank you so much for coming. And you're welcome. And Dr. Bala, thank you. I just want to share with the community, and I think next week or the week after, we are going to have a WebEx, and it will be focused on business. And we'll have the Chamber of Commerce and some of our local business interests coming to talk about what's going on with our business community. At this point, we have almost 11,000 employees because we're such a rich business community that have lost their jobs because of business closure. So it's been very, very sad and difficult. We're going to be looking at certainly a downturn in our economic forecast as we move forward in the next many months, but I think it will be very advantageous for our public to be able to ask some questions of our business community, and we will notify you in the next week or two when we host that. So thank you once again for attending. We appreciate all your support. Be safe, take care of yourself, and let's be kind to one another because we're all under a lot of stress. Thank you.